So let's review some of the CPC quiz question which will help you for your exam preparation. So we have first ICD question. Here they are asking about what is the correct coding approach for an outpatient visit. So whenever you are coding in outpatient coding, uncertain diagnoses are not coded as confirmed. So if you observe the question, they said consistent with metastatic lung cancer. So the word consistent, probable, possible, suspicious, all of these, not confirmed diagnosis. So we will only code findings at this time. So that in the first question, answer should be C, R91.8. So the second question, again here it is a modifier usage question. If you thoroughly check the question, there is a time increment. Okay, so the surgeon documents that because of the patient body had an extensive arthritis and the damage to the femur and the tibia, so the replacement procedure took 120 minutes longer than the routine arthroplasty. So which says there was an increased procedural service, so you must use modifier 22. Same way we have again another modifier question. So which modifier is used to indicate patient has a enteral nutrition pump on the rental basis? So for the rental basis, you have to use RR modifier. So RR refers to rental. Same way NU modifier indicates new equipment or a purchase. KX indicates there is a required specified in the medical policies have been not met. MS refers to maintenance and servicing fee after 15 months rental period. So then we have another compliance question. Which of the following qualifies for a federal IDR process? So federal IDR process does not apply to Medicare, Medicaid or TRICARE, and same way they don't apply for CHIP also. So here we have none of the above will be the answer. And last question, according to the current guidelines, what age should screening mammography begin for an individual? So the American College of Radiology recommends that individual at average risk for a breast cancer begins at the age of 40. Okay, so they will take annual screening mammography at the age of 40, and earlier screening may be recommended for individual with the elevated risk factors, which means the family history, and if they have the history of family with the breast cancer, they can take earlier mammogram